Hi friends, I'm Abby, a registered nurse here at Blueprint Nursing. If you've seen our videos before, welcome back. If you're new to our YouTube channel, hello! I'm excited that you're here and that I get to help you in your journey to becoming a real deal registered nurse. Today we'll be reviewing TPA and its uses in stroke management. Before we jump into today's topic, don't forget to subscribe so you never miss a video, and check out our Instagram and TikTok and our website for all of your NCLEX Prep needs. Let's get into it. So what is TPA? TPA stands for Tissue Plasminogen Activator. It is a medication sometimes referred to as a clot buster or a thrombolytic agent. Thrombolytics are used to help dissolve clots, like in cases of pulmonary embolism and DVTs. They're often used in cases of acute ischemic strokes, since the clot is blocking blood flow to the brain. TPA can be administered via IV or intravenously, or IA intraarterially. The most common form of TPA used in stroke management is alteplase, and it is administered via IV. It is typically given with an initial bolus of about 10% of the total dosage, and the remainder is infused over 1 hour. TPA administered through IA is not as common, but it allows the medication to be administered directly into the artery where the clot is located. What is the most important thing to know about TPA? Timing. TPA is a highly time-dependent medication and is most effective when administered within 3 hours of stroke onset. The earlier it can be administered, the higher the likelihood of reducing stroke-related damage and improving client outcomes. Let's go over indications and contraindications. Can anyone with any stroke receive TPA? No. Clients must have a confirmed diagnosis of an ischemic stroke with measurable neurological deficits, and a hemorrhagic stroke must be completely ruled out, which is usually done with the CT scan. There are several reasons why a client is deemed ineligible for TPA, and those include a hemorrhagic stroke, as we wouldn't want to make these clients bleed even more, any recent surgeries, history of intracranial hemorrhage, uncontrolled hypertension, active internal bleeding, and certain clotting disorders. Moving on to complications and outcomes. Did you notice a common theme in clients deemed ineligible for TPA administration in the previous slide? Take a moment to click back to that part of the video and see if you notice it. Think you got it? Bleeding, yes. The most significant risk with administration of TPA is the potential for causing a hemorrhagic stroke or bleeding in the brain, as well as bleeding in other areas of the body. It's important that clients are carefully selected for TPA administration and carefully monitored during and following administration. These clients typically require close monitoring in the ICU or a stroke unit. A few nursing considerations to keep in mind. Prior to administration, you're going to want a set of baseline vitals and baseline labs, potentially including a CBC, PT, and INR. And you're going to want to review the client's history for any of those contraindications we discussed, such as a recent surgery or active internal bleeding. During and after administration, you'll want to monitor vital signs, especially for signs of internal bleeding, like a rapidly decreasing blood pressure. During administration, you'll want to look for signs of an allergic reaction. Then following administration, you'll look for signs of active bleeding every 15 minutes for the first hour, every 30 minutes until the 8th hour, and then hourly thereafter for 24 hours after discontinuation. When TPA is administered within the recommended window of time, clients are more likely to see improved neurological outcomes and reduced disability. The earlier we're able to reperfuse the brain by busting up that clot, the more we see improved recovery and quality of life long term. Here are our references used for this topic. Thanks for reviewing TPA with me today. If you have any other topics you'd like to see covered, leave them in a comment below. And don't forget to check out our website for other NCLEX Prep resources. See you next time.